Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Peripheral artery disease is a common problem of circulation caused by narrowing of the arteries due to plaque formation, which reduces blood flow to your limbs. When you develop peripheral artery disease, or PAD, your extremities, usually your legs, don't receive enough blood flow to keep up with the demand. And this can cause symptoms, usually leg pain when walking, known as claudication.
PAD is also likely to be a sign of a more widespread problem, the accumulation of fatty deposits in all of your arteries, known as atherosclerosis. Here to discuss peripheral artery disease is Mayo Clinic vascular surgeon, Dr. Randall DeMartino. Welcome back to the program, Dr. DeMartino.
Thank you. Good morning.
Dr. DeMartino, always good to see you. So this term, peripheral artery disease, break it down for us, define those terms so our listeners know exactly what we're talking about.
Sure. When we talk about peripheral artery disease, peripheral meaning the circulation mostly to the extremities, often the lower extremities, as opposed to central atherosclerotic disease, which we usually refer to as in the heart. As far as the arteries, we differentiate them from the veins. The arteries are what bring blood flow to the organs or to the extremities. The veins are responsible for bringing it back. And the disease, typically in older patients, we see the hardening and plaques that build up over time that can limit circulation to the extremities and causing the symptoms as you were just discussing. Typically cramping that occurs with walking as your muscles need more oxygen. The blood flow can't keep up with demand. You get a cramp, similar as if you would run too hard and you need to take a couple deep breaths. And as you relax, the blood flow and oxygen levels reaccumulate and the cramp goes away and then you can go again. Typically that can happen over and over again. It's called window gazer's disease because people would walk down the street, they get a cramp, they just stop, look at a window, and a few minutes later it's gone, they can go on their way.
Window gazer's disease? I like that.
That cramping is the main way that you know that someone has PAD?
That's the most typical symptom. You can have some people who have very minor blockages may have no symptoms. Patients who have very, very advanced disease may have pain at rest. We call that rest pain. And patients who have even more profound disease may have wounds that can't heal because of lack of oxygen.
So what's the cause, the underlying cause? You talked about atherosclerosis and clogging up of the arteries, but why some people and why not others?
It can happen for a multitude of reasons. It can be some of them, maybe not all of them, depending on genetics that can contribute as well, like heart disease. But typically advanced age, men versus women are more likely to get it. Smokers, whether previously or current, and high elevated cholesterol levels, especially over time. It can be diabetes as well, can be a major contributor, renal disease, such as patients on dialysis. So these are the patient populations we see the most. As I say, many patients have some of these factors, not all of them. Some people who have genetics may not have any of them.
Diabetes, you mentioned, and it seems to me like we're seeing more and more patients who are diabetic who have this problem. Diabetes raises havoc with your blood vessels.
It does. The long-term elevated blood glucose or blood sugar levels cause damage to the artery walls. It's a little bit different than the typical smoker disease that they get in the thighs. Diabetes can sometimes affect the smaller vessels in the calf, but results in very similar problems in terms of the circulation.
So how do you diagnose it? Is it just you get the cramp? That's the most obvious way to diagnose it?
An astute clinician may pick up on that description and be able to gather a likely diagnosis. Physical exam is helpful when you see your doctor in terms of palpating pulses, but an ankle brachial index, which is where they measure the blood pressure of your arms and legs and compare the two, is the most typical way to formally diagnose the disease. And we get a ratio where if it's less than 0.9, that's typically abnormal. And then there are ranges that we see for claudication, typically from 0.5 to 0.9. And then for patients who have more advanced disease, it may be lower than that.
Explain that test for us, the ankle brachial index.
A technician will take a blood pressure of both of your arms, usually use the higher value of the two. Then they'll put the blood pressure cuff or a special one on your ankles and do the exact same test. And then they basically just do a fraction of the ankle number over the brachial number.
I'm the layperson here. I know you're checking blood pressure, but it would make sense to me that your ankle is farther away from your heart. So maybe that blood pressure would be a little bit lower. Should I go to medical school?
Actually, it's in the normal person, it's slightly higher.
Really?
That gets a little bit more in depth, but typical normal value is 1 to 1.1. So when we do see people below 0.9, that's typically an abnormal value.
So what that test shows you, if there's a significant reduction in blood flow to the lower extremity.
Exactly.
All right. So you've made, and by the way, there are other things that can mimic peripheral artery disease, like spinal stenosis, for example, can cause similar symptoms, right?
Very much so. That sometimes is referred to as neurogenic claudication, although that's somewhat of a misnomer. But it causes very similar lower extremity symptoms with walking, typically when you're more upright, as the nerves are pinched. But as opposed to peripheral arterial disease, where just stopping will make your legs better, these patients typically have to sit down and roll their backs forward, and that relieves the compression on the nerves. That's one way to tell based on history.
All right, let's talk about treatment, because I know you've got a lot of options, and you're much better at treating these patients than you used to be.
Exactly. The first and foremost thing is making sure you're on the right medications. Typically, non-surgical treatment and modification of risk factors is the number one thing to do. So making sure you're on the appropriate cardiovascular protective medicines, as we discussed. It's a systemic disease often.
So when you talk about risk factors, so if you smoke, you got to quit smoking. If you're diabetic, you get your blood sugar under control. The medication, what kind of medication are you talking about?
Most patients with symptomatic peripheral arterial disease are recommended to be on statin medications for control
keep their
of
cholesterol down. Okay.
And antiplatelet medicines such as an aspirin or clopidogrel or Plavix are
to
often
keep you from
recommended.
forming clots in the artery. Okay.
Mm-hmm. After that, we recommend walking programs for patients. So these are sessions that are 3 times a week for 12 weeks, similar to a cardiac rehabilitation type of program. And they work at developing collaterals or accessory arteries or smaller arteries to work around blockages. So I talk to patients, it's like, sort of beefing up your back roads in case the highway's closed. So you can get better flow down to the legs.
But do they have to walk through the pain? If they get cramping that happens, they just have to keep on walking?
Exactly. That's what tells the body to create new channels or expand the channels that it has.
They're easy to spot at the gym because they're crying while they're walking.
Yeah.
All right, and let's say that they've done all those things you've suggested, and they still have the problem.
So after a trial of exercise therapy for claudication, if there's symptoms are still lifestyle limiting, we can offer either endovascular techniques, which may involve placement of a stent or balloon across a blockage to expand it and reopen it, similar to how they do in the heart. For advanced blockages or long blockages, bypass surgery may be recommended, and that's where we use a vein or another conduit or material to bring blood flow around a blockage, similar to a heart bypass.
So tell us a little bit more about this balloon procedure. You actually snake a catheter down into the area of the blockage, balloon it to open it up, and then you put a stent in there to hold it open?
Correct. This can often be done as a same-day procedure. You're typically sedated, so not fully under anesthesia, and we navigate a wire and catheter across those blockages, and then the stent is to help reinforce and prevent a re-narrowing from happening in the future.
And how successful is it?
It depends on the length of the blockage and the degree of narrowing, whereas a narrowing may be easy to cross, a total blockage may be more difficult, so it depends on the characteristics. And so imaging is usually used either before or during to help make that assessment of whether a stent is appropriate and would be likely to be successful.
Even if you surgically treat them, though, I would imagine that you have to still make the lifestyle changes and different things of that nature. Otherwise, you'd be right back there getting another surgery. Or does it take care of it and you don't have to do it again?
You're exactly right. It is imperative that all of these more advanced treatments are all built off of lifestyle modification as the first thing. We know that any of these therapies will not work as well if you continue to smoke or don't control your blood sugars or cholesterol.
And we should probably let our audience know that sometimes if the endovascular procedure, the balloon procedure doesn't work, then it might require open surgery, and sometimes that's not successful, and an amputation can be the result.
Unfortunately, in very advanced cases, patients with advanced disease, that can occur. We do everything we can to prevent that, and often patients may have to go through multiple procedures in order to make sure that we can salvage the leg in a very advanced state.
All right, peripheral artery disease, symptoms, risk factors, diagnosis, and different ways to treat it. Dr. DeMartino, thanks so much for being with us.
Thank you for having me.